razor.
Oh man, it's my favorite part.
This is what?
It's my favorite part.
You're so rude. Just for clarity, was I able to take this off? Because I actually didn't, so it smells really bad.
You didn't take it off the whole time?
No.
Oh, wow. Yes, you were able to.
Okay. Because I was just anxious about it.
That's
so
okay.
I just didn't. So it's probably gonna smell. Can I wash it too?
Absolutely.
Okay, great. I'm gonna do that.
Yeah.
How long do I have
It's
to wear it
preferable,
for?
actually.
Yeah.
Seriously.
Cleanliness is preferable.
Yeah.
Usually have you wear it for 3 to 4 weeks.
Okay.
So, and if this is one that's kind of uncomfortable for you, if you have a binder or something like that, it's also fine. Just a little bit of compression on the
Some sort of
chest.
compression.
Yeah, exactly. So you haven't unwrapped this the whole time?
Nope.
Okay.
This is just really gross.
All right. So I'm going to take those dressings off the nipples and get these drains out. Okay.
Okay. Oh, it's like painful.
Yeah.
I mean, they're a little yellow right now, but I don't.
You're so rude.
All right. Yeah. So.
Should I take
Yeah.
this
Let
whole
me
thing off?
actually just have you.
Take the thing off?
Have you lift your arm to the side. Okay, good. All right. Yep. Why don't you just lay back? I'm gonna lift your arm to the side. I'm gonna work on getting this tape off you. Okay. It's just a lot of tape. All right. It's a little stuck on the hair, so if you feel any pulling there, that's just like a little hair being pulled out. And it's going to be okay to start showering tomorrow, okay?
Tomorrow, not today. Okay.
Shower. Well, I would say tomorrow because, you know, it gives the little holes where the drains come out
Okay,
a
yeah.
little bit of time to kind of seal and
Yeah.
scab over.
Okay.
So I'll just tape. All right.
Okay.
That one's off.
Great.
Okay. Get to the other one. Come up a little bit.
I know, I think it's
I couldn't tell if it was this door or another one either.
So when you say like wear it for 4 to 6 or 3 to 4 weeks, is it like
Not all the time, you know, you just
Okay.
you take it off the shower,
Yeah.
you know, take it off if you feel uncomfortable, want to let your skin breathe, but yeah, it's just
Should we
for,
sleep with it on?
if you can, if it's too uncomfortable, then don't worry about it. It, you know, it just helps with some of the swelling, so
Okay.
that's all it's doing.
How long before I can sleep on my side again?
It's okay to sleep on your side, just I wouldn't sleep on your chest for maybe another week or so.
Yeah, yeah, yeah. Okay.
Okay, it's off. Alright, so, gonna be a tiny little stitch to cut, okay? Ready? 1, 2, 3. Okay, that's it.
Oh, okay, that wasn't bad.
Good. Now I'm gonna have you squeeze your arm down for a sec. Good.
All right, halfway there.
Not bad at all, right? Okay. All right, let me take a look here. So if you notice a little bit of, sometimes a little bit of drainage can come out of that hole for the next 24 hours or so. That's normal. It should scab over and stop draining within the next 24 hours or so. Okay.
Okay.
All right. Ready?
Yeah.
1, 2, 3. Okay, good. All right, squeeze your arm right there. Up. All right. Let's get the dressings off the nipples.
Does that hurt?
No.
Okay. Sorry.
Everything.
So much anxiety.
Maybe I'll just say no to everything.
It looks good so far.
Yeah.
Yeah. Looking like your average bird-chested 23-year-old.
Bird just. Gotta work out after I can.
It's okay. Baby steps, one step at a time.
Yeah. Completely took.
Okay, what does that mean?
It all took.
That's a good thing.
It's a good thing.
Yes.
Great.
And it's usually going to kind of contract a little bit as it heals.
Okay.
As in, it could get a little smaller
Okay.
as it heals. That's just kind of how the graft heals. So everything looks like it's healing well. All right.
And there's number 2.
All right. Yeah, both of them took well. Tiny little area right here that's a little bit darker, or blacker. Some of that a little bit of the superficial skin might you might notice it a little peely.
Okay.
Put some antibiotic ointment over everything for the next week or so, and then just cover it up with a after you shower, cover it up with a non-stick bandage. Everything essentially took, so it looks great.
Great.
Yeah, your healing is going great.
Yeah.
So take a normal shower tomorrow,
Okay.
and then.
So I should cover it up with a bandage like this?
Yeah, exactly, because there are little tiny holes that I poke in the grafts to keep the fluid draining out, so it takes those take a little bit of time to heal in, so it might look a little bit pink or raw.
Okay.
But that's normal.
Okay.
But everything, I'm happy with how everything looks.
Great.
So I usually see you back in about a month, just to recheck on how everything heals.
Okay.
That way I can kind of recheck how the scars are healing and make sure that no scars are getting thicker or anything like that, and everything's going according to plan. Okay.
Okay.
Once these white pieces of tape start falling off.
These?
Yeah. So those.
They'll fall off on their own.
They'll fall off on their own. So as you start getting them wet and start taking showers, you'll start noticing them starting to peel.
Okay.
As they peel, you can just take it off completely.
Okay.
And then once they all fall off, you can start using, if you want to use like a scar treatment on it, like
Right.
something like, silicone
Yeah.
sheeting or something like that,
Yes.
then you can start using it after the white pieces of tape fall off.
Okay, and it's
Okay.
only once they fall off that I can use
Yeah,
it.
once they fall off, or else it's not really going to have much effect.
Okay.
So,
Great.
yeah,
And you said antibiotic treatment on the nipples for how long again?
usually about a week.
A week.
Yeah,
and then
before them to completely heal. And if you notice anywhere that's raw, or not doesn't look completely healed yet,
Yeah.
then just keep using the ointment on that area until it's completely healed. Until
Okay.
it's basically dry.
Okay,
And
that's like Aquaphor or something like
Aquaphor is also fine. Aquaphor just is kind of like a Vaseline, but just doesn't have the antibiotic ointment in it.
that? Oh, so it needs to have the antibiotic.
For the next week or so.
Okay.
Yeah, so something like Neosporin or
Okay, got it.
Bacitracin. Yeah.
Okay.
All right.
And do I need to put gauze or anything on?
You don't have to put gauze on it. Just something non-stick, like a big Band-Aid, like
this is
this.
fine.
Yeah.
Okay.
So that way it won't stick to the nipples.
Okay.
Okay.
Great.
But you look
Thank
great.
so
All
much.
right.
Thanks.
Yep.
You look great.
Yeah. Mind if I take a picture with you like that?
Yeah.
Just-
Sure.
I was actually about to ask, do you want to take a picture?
yeah. Let me take one real quick.
Please.
And
And then this I just take off.
you can take that off when you take a shower tomorrow morning.
Okay.
I bet you better have a better face than that.
I don't think my face is.
Your face isn't in it. So, all right. Let me fill this out for you. You can go ahead and get dressed. Okay.
Okay. Thanks. Let me look in the mirror. No.
Just wait for a second.
What?
How's it feel to just have that fucking binder up?
I know.
It's
It feels so good. First of all, I'm like my neck, like my back. It just feels like free. Now I'm like, why didn't I take it off in the first week? That's a real question. But
It's okay.
Yeah.
It wasn't anything harmful. So.
Right, that's true.
Yeah.
Just need to take a
Are you ready to look in the mirror?
I guess
Do the big. This is perfect.
Is it right?
We already have the curtain. All right.
Oh my god.
Samya,
Wow,
meet
wow.
Samya.
Wow, this is crazy.
Look at
So
you.
crazy. Okay. This is me.
Wait, turn. Look in the mirror.
Yeah.
Stand the way you were,
Wait, like this?
like that. Yeah. And
Take
then
it
turn
out.
your head a little to the left.
Like this?
Yes. Excellent. So how's it look?
Crazy. It looks good, I think.
Yeah.
Yeah, like I mean, I don't feel like I'll really know until the scars are like, but they look pretty straight. Right?
Yeah.
And like I don't see any, like sometimes they happen with the little, like sometimes there's like fat that like doesn't, quite distribute correctly. It doesn't look like that's happened. So I mean, I don't know. It looks good.
It does. It does.
Oh, that's so crazy. Ooh, okay. Yeah. Okay. All right. What do you think about this part right here? Do you feel like it's sticking out a little?